Hello and welcome. If you are looking for the information session about radon monitors and lending programs, then you're in the right spot. And we are so thankful that you are joining us today. We will give everyone a few minutes to join in here, and then we will get started. But I think everybody's pretty familiar with Zoom, but we do want you to have the opportunity to ask questions and to chat. So feel free to chat in and say hi to the team on the chat, and then we will get you to use the Q&A button to post questions throughout it. And I'll probably repeat this all in a minute just before we get started, just to give people a chance to come in.
Yeah, welcome everyone. We still have power here in Vancouver, which is kind of amazing because all along the east coast of Vancouver Island, they've had a massive storm overnight. So there's lots of communities without power today.
Yeah, lots of weather events happening, I think, across the country as we move
into winter.
Winter, yeah. All right. Well, thank you all for joining us. This is the Radon information session for the Radon Monitor Lending Program. We are so thankful that you have joined us. Many of you are in libraries across the country, so feel free to chat in. Let us know where you are, and it would be great to hear a little bit of chatter throughout the program. So, or throughout the presentation, it'd be great to hear some of your thoughts on how your programs are going. And so as we talk about different aspects, feel free to share some of the things you guys are doing in your libraries in the chat. If you have questions, then we'll get you to use the Q&A button and post those in. And you can feel free to put those in anytime, but we will take time at the end to go through the Q&A. All right, I'm going to introduce our speakers. So we have Dr. Anne-Marie Nicol. She is an epidemiologist with Simon Fraser University, and also an associate professor there, also works with BC CDC and consults with BC Lung, and does a number of also as part of our Take Action on Radon team. And so we are super grateful for Anne-Marie taking the time out today to share with us. And library loan programs is also one of her passions. So we are really thrilled that she's here talking about that. And then we also have Caitlin Penstone with Health Canada, and she has been involved in the steering committee that's sort of bringing all the different regions and groups together to put forward some resources and such together for libraries. And so she's going to come and share with us as well. So Anne-Marie and Caitlin, I'll hand it off to you.
Thanks very much, Pam. Okay, I'm going to stop sharing and I'm going to let you drive for a bit, Caitlin.
Sounds good. All righty.
I see some people hailing in from Ontario. Welcome. People are putting where they are from the chat.
All righty. Hopefully everybody can see my screen here. I'm just going to start the presentation. The computer will wake up.
Yeah, looks good.
Okay, so let's start with basics. What is radon? Radon is a radioactive gas that is produced by the breakdown of uranium in soil and rocks in the ground. When radon gas is released from the ground into outdoor air, it is diluted and it's not a concern. However, in enclosed spaces like homes, it can accumulate to high levels and becomes a risk to the health of you and your family. The Canadian guideline for radon is 200 becquerels per meter cubed. You cannot see or smell radon gas, and all homes have some level of radon, unless they're on stilts or in a tree. And the question is how much? And the only way to know is to test. If the radon level in your home is high, it can be fixed. So where does radon come from? There are four major sources of public exposure to natural radiation: cosmic radiation, terrestrial radiation, inhalation, and ingestion. And there are four categories of artificial sources of radiation: atmospheric testing of atomic weapons, medical sources like X-rays and CTs, industrial sources like density gauges, smoke detectors, and glow-in-the-dark exit signs, and nuclear fuel cycles or power plants. Of all of these sources, it is estimated that radon represents almost 50% of a person's lifetime radiation exposure. This is why it's important to know about and take action to reduce your exposure to radon. What you can see on the screen is a map of radon levels across Canadian regions. This map was recently published in the 2024 Cross Canada Survey of Radon Exposure in the residential buildings of urban and rural communities. This survey found that approximately 1 in 5 houses in Canada have radon levels at or above the current Canadian guideline of 200 becquerels per meter cubed. Whether you live in an area with low or high radon, or if you know your neighbor tested and found low or high radon, you cannot predict or know what the radon level is in your home. The only way to do that is to test. So where can radon be found? Radon is found in all homes and buildings in contact with the ground. Dr. Chen, one of Health Canada's National Radon Program's senior researchers, recently released a publication entitled Risk Assessment for Radon Exposure in Various Indoor Environments. Dr. Chen looked at radon survey data from workplaces, schools, and homes and found that on average, radon concentrations in Canadian homes are about 3 times higher than in school buildings, 4.7 times higher than in public buildings and indoor workplaces. Canadian statistics shows that most Canadians spend approximately 70% of their time indoors at home, 20% away from home indoors, and 10% outdoors. Due to the relatively higher radon concentration in homes and longer time spent indoor at homes, the exposure at home contributes to 90% of the radon-induced lung cancer risk. So how does radon enter a house? Several factors influence the amount of radon that moves from the ground into the home and the amount of uranium, or including the amount of uranium in the ground surrounding your home, the construction type, foundation condition, occupant lifestyle, meaning how many doors and windows you open, and finally, the weather. The temperature or winds and rainfall can all influence how much radon gets into your home. Because radon is a gas, it can easily move from the ground into our homes through any small openings it can find, like cracks and gaps in the home foundation floor, around pipes, and in the floor/wall joints. You can see in the image on the slide all the different ways that radon can enter a building. The health risk from radon is long-term and depending on 3 things: how high the radon level is, how long you're exposed to it, and whether or not you're a smoker. Radon is recognized by international authorities and experts as the leading cause of lung cancer in non-smokers. Lung cancer is the most common cancer in Canada, and the survival rate is low, about 20%. Testing and reducing your radon exposure is the best way to reduce your risk of lung cancer if you don't smoke. It's estimated that 30% of lung cancer deaths in Canada are non-smokers. Smokers also exposed to radon have significantly increased risk of lung cancer. Health Canada estimates that more than 3,000 lung cancer deaths a year are radon induced. That's equivalent to more than 8 people a day. Radon is a very significant but preventable health risk. So radon gas breaks down to form radioactive elements that can be inhaled into the lungs. In the lungs, radon continues to break down, creating radioactive particles that release small bursts of energy. This energy is absorbed by nearby lung tissue, damaging the lung cells. And when lung cells or cells are damaged, they have the potential to result in cancer when they reproduce. Exposure to radon and tobacco use together can significantly increase your risk of lung cancer. We estimate that your risk from long-term exposure to high levels of radon is 1 in 20, or a 5% risk of developing lung cancer. But as a smoker, also exposed to high levels of radon, that risk increased to 30%, or 1 in 3. As a smoker not exposed to high radon, the risk of lung cancer is approximately 10%, or 1 in 10. Despite the significant risk, radon is a very challenging risk communication issue, one that many people don't know or worry about. First, people who don't smoke don't tend to worry about lung cancer. On top of that, you can't see it, smell it, or taste it. Radon is naturally occurring, so there isn't a bad guy who created it to make you mad or worried. And because the health risk is long-term and not immediate, like carbon monoxide, many people don't believe that radon is a risk that they have to worry about. In an effort to better communicate the risk from radon and get people to pay attention, we try to compare it to other risks that people do worry about and take action. The chart on the slide compares the risk of dying of radon-induced lung cancer to other better-known risks such as car accidents, carbon monoxide, and house fires. As you can see, the risk of lung cancer from radon gas exposure is significant. If you change the batteries in your smoke detector, if you wear a seatbelt, if you have a carbon monoxide detector, then you should also test the radon level in your home. So how do you test? It's quite simple. You have two options: purchase a do-it-yourself test kit or hire a certified radon measurement professional. Whatever you choose, you need to do a long-term test for a minimum of 3 months, ideally during the fall or winter time when your windows and doors are closed. Long-term testing is important because radon levels can vary significantly over time. As you can see from the image on the slide, short-term testing can lead to false negatives or false positives. The Canadian guideline of 200 becquerels per meter cube is an annual average exposure level. To be able to estimate your annual average exposure level in your home, you need to test for a minimum of 3 months. This will allow you to compare your home's radon results to the guideline level and determine if you need to reduce the level in your home. To find a certified test kit or measurement professional, you can go to takeactiononradon.ca/test. The use of electronic radon monitors in Canada is increasing. Health Canada recommends purchasing an electronic radon monitor that has passed the CNRPP performance testing for conducting long-term radon measurements in homes. Radon levels vary from day to day and week to week. Although the electronic monitors listed here provide results quickly, it's important to leave them in place for at least 3 months to get an accurate representation of your average radon level. Short-term measurements can be misleading, either much lower or much higher than your actual radon level. And you should still be following the long-term testing guidelines when using an electronic radon monitor to test your home. So placing your radon monitor in a room that's occupied for at least 4 hours a day, testing for a minimum of 3 months, preferably during the heating season. And consider the long-term average radon level when deciding whether to mitigate your home. Electronic radon monitors each have different methods of averaging the data. We recommend that you read the manufacturer's user guide to determine how to read the long-term radon average. If you've tested your home and the radon level is above the Canadian guideline of 200 becquerels, Health Canada recommends that you take action to lower the level within 1 year. The higher the radon concentrations, the sooner action should be taken to reduce levels to as low as practically possible. While the health risk from radon exposure below the Canadian guideline is small, there is no level that is considered risk-free. It's the choice of each homeowner to decide what level of radon exposure they are willing to accept. Techniques to lower radon levels are effective and can save lives. Radon levels in most homes can be reduced by more than 80% and can typically be installed in less than a day. Health Canada recommends that you hire a radon mitigation professional that has been certified under the Canadian National Radon Proficiency Program, or CNRPP, to help you find the best way to reduce the radon level in your home. The most effective radon reduction method is called active soil depressurization. This method involves installing the pipe through the foundation floor that leads outside of the house, either at ground level or the roof line, with a fan attached. You can see examples of this method depicted in the images on the slide. The system draws the radon from below the house and exhausts it to the outside before it can enter your home. Radon gas quickly gets diluted to low levels outside. Installation of an active soil depressurization system by a CNRPP certified professional typically costs approximately $3,000 to $4,000. And I'll pass it back to you.
Thank you very much, Caitlin. Okay, I'm going to share my screen now. Thank you for that comprehensive overview. And if you do have questions about radon, please feel free to put them in the chat. Caitlin will be monitoring them, and we can also answer questions about health effects and other things if you have them at the end. We're going to switch gears a little bit now and talk about setting up a radon monitor lending program in libraries. And just to say that our definition of what is a library is pretty broad. We know across Canada, there are programs that lend devices both in public libraries, academic libraries, and also libraries at cancer agencies. So we're a very inclusive, I mean that in a very inclusive way when I say library. So if you don't have a radon monitor lending program and you're interested in having one or hosting one, there is a number of different ways that you can go about doing this. The first is to reach out to an organization that's facilitating lending programs. So that includes Take Action on Radon, where we're basically calling in from today, but then also provincial lung associations facilitate people to set up programs as well. You can acquire the materials that you need for the radon test kits, and I'll show you what that looks like in a minute. That includes accessing a monitor. So most of the libraries across the country use a device that's created by Airthings. There's a little picture of it down on the right-hand side. This is a monitor that provides a digital display so that people can see the number. And there's a few reasons why we've selected this device that I'll talk about in a minute as well. And then a tub to put it in. And what we've really learned is that library lending programs put the devices and the kits in all sorts of different sections of the library. Some people consider them a library of things or Internet of Things concept. Some end up in STEM or STEAM libraries, and then sometimes they're in energy efficiency catalogs. So we found a real diversity of how people understand and frame radon lending programs in the libraries that currently lend them out. So here in British Columbia, this is what most of the kits look like. We have a little plastic tub, and then we have some handouts. We have the Health Canada pamphlets that are included. And for each province, there are different provincial resources that can be put into the tubs. And then this is the monitor. So just a few minutes about this device. It has been tested and it found to be quite a reliable device. It requires batteries, and that is one thing that sometimes the batteries need to be replaced. We have had, at least in British Columbia, we have had very few of them malfunction. And the device manufacturer, I think we have Julie online today, who is our Canada rep for these devices. And she can answer some questions for people if they have them specifically about the units, but they seem to be fairly robust. And when we do have problems, Julie has been very responsive. But so far to date, very few of them have acted up for us. The other nice thing about them is that they don't retain data. So people often ask about issues if I hand it back, will people know my radon levels? And they can be reset easily by the patron, and they don't collect the data. So there are other devices that do have digital displays, and there's other ones that communicate with cell phones, but we've chosen not to use those because of data privacy issues. Again, people would prefer often to not have their data shared. And also the simplicity of use, because for many people, the idea of having to connect it to a smartphone can just be too many extra steps. So to date, this is the most reliable and most visually understandable device for other people. That may change over time, but to date, this is the machine that is used most commonly by library programs. There's also information in the kit about where to put the device, how it works, and troubleshooting, and then contact details for the province. So if you want to start a library program, we do have a how-to guide at Take Action on Radon. So it'll walk you through basics of radon. We don't expect librarians to be radon experts, although you know a lot more now than you may have if you'd never heard of radon before. And then we spell out a bit more about radon and libraries, how you can look after these monitors, these digital devices, and then the contact information. So this is available on our website. If you want to sign up, you can put your information in, and then we send you this information. you can customize the resources that we have for your library. So the Mississippi Mills Public Library in Ontario, this is what they've used. They put their logo on the front. We encourage people to do this. And this is the handout that comes in the kit. It is very much in much more lay language than some of the other information in the how-to guide. We use a personal story to talk about how radon has influenced people's lives. And yeah, you can customize it as you wish, and then print it out and put it in your tubs or kits. Another thing that we'd like to flag is that radon is best tested during the heating season, especially because these devices that we're using are not long-term alpha tracks, which is the most reliable way of testing for radon. Rather, they are a screening tool. And that's usually because you need to test for radon again for about 3 months for it to be the most accurate assessment of indoor environments. And we know that library lending periods are often only 2 to 4 weeks. So that doesn't really give you enough time for that 91 days. And also, it's really important that people test over the winter time to have the most accurate assessment. So we really recommend that during this summer, the devices are not lent out. And then this is a period of time where you can check to see if the devices, the batteries are still okay and if they're still working. And there's a few ways of doing that. One of them is to compare them to a more professional device. So in BC, the Lung Association has a professional device, and the detectors can be sent to BC Lung, and we will compare them to what the professional device is measuring in a closet. It's actually quite a thing to see, but you can also do it just by having devices put side by side to make sure that they're both still sort of tracking at the same level. And yeah, I see some questions popping up, so we're happy to talk about that later. We do find that there are challenges with this pulling back of the devices, especially in places where there are long wait lists, because we do know that there's libraries in Canada where people want to lend the devices they would like access to them all year long. And that is a current issue that we are open to discussion about. But just to know that a screening tool that's done in the summer is likely far less reliable than one that's done in the winter when homes are more closed and there's less indoor-outdoor air communication, and therefore radon levels are likely to be higher. So common questions that patrons have, besides what is radon and what is its health effects, or where to put it. And so these are some examples of where if people ask you where you can put the devices, they are best if they are put in places where people spend 4 hours or more, a bedroom or a sitting area, a home office. And because radon is a soil gas, it's rooms that have ground contact, basements or first floors, where we usually recommend that people test, because that tends to be where the radon levels are higher. However, you don't have to have a ground contact room to take out a device. If you live in an apartment building or a mobile home or any kind of home, we recommend that people test. So there is no limitation on where a person can test. It's just best to have it in a space where you spend 4 hours or more. So we know that there's many libraries across the country that are lending devices. And again, they're all fascinating. They have different permutations and different collections and different information. So if you do have a library program, one thing we like to know is, when was the last time you took a look at your devices? Some libraries have a lot of devices. So we're wondering how people are doing with checking and replacing things like batteries. Are people feeling pressure to lend them over the summer? And we know that people sometimes take the information out of the kits and keep it, and that's great, actually. So Health Canada does provide updates for resources, and there are often new resources that come out and new pamphlets. So if that's a case, and are you checking the tubs to see that their resources are replenished? And are there other things that you find patrons are asking that we can help you create new FAQs for? So we don't follow up with patrons about their radon testing, but you might hear more in libraries about what people are wondering about or interested in. So we are happy to continue to build this program and make new resources if they're necessary. In British Columbia, over the last 6 months, we've started an evaluation, a more robust evaluation of our radon lending programs. And we wanted to find out where in BC the libraries were lending devices. There's been a number of different initiatives in this province to build capacity in libraries. So we just wanted to take a peek and see. And then we wanted to know if librarians are being asked questions and how engaged librarians are. And then maybe there's new avenues for radon awareness and education. So we did a physical assessment, Riley did, who's here on the call, of all the different systems that are lending devices. You can see this is the Fraser Valley Regional District, how they set theirs up. And this is, I'm sorry, I've cut the top of this one off, but I believe this is in North Van as well. And again, you can see people show a picture of the device, and then they, oh, sorry, this is a Sunshine Coast. And then they say where the library is that people can go and pick it up. And you can see the one in Gibson's, they have 3 checked out, but there's 1 back in the library. So what we found from that analysis is that we have about 64% of the library systems in BC taking part. And of those, 53 have a wait list for detectors. The biggest programs occur in the interior health region of BC, and that's a region where we actually know the levels tend to be quite high. 1 in 3 homes tested so far are above the 200 becquerel guideline. We did find 1 region, though, that had no detectors. So this points to the utility of this work, because we can do some more work, increasing programming in that region. And that 20% of the libraries offered the devices with other digital air quality monitors, so including things like PM 2.5 monitors and CO2 detectors. So these are sort of an idea of like putting radon into systems that are testing and monitoring our indoor air quality. And that not all libraries provided the same information. And that's one thing that we really want to make sure is that people across the country are getting consistent information, particularly as there's often updates to what's going on. And so making sure that you have the most recent Health Canada publications and enough of them is one thing that we would really like to encourage. And this call into other librarians in general. If you'd like to talk to Riley a bit more about libraries and library lending, particularly if you're from BC, but if you're from anywhere else as well, we're again really interested in librarians' experiences. So Riley's email is here, and I think she can probably pop it in the chat. We are doing this research through Simon Fraser University, and it has going through an ethics application process. So just so people know. So they're beyond the library testing promotion of the kits and the tubs, as they're called. There's other things that you can also, librarians can do, and that's why we're really glad you're here today, because there's other ways to promote your library program. And one of them is right now it's Radon Action Month. So November is Lung Health Month, and as a result, Radon Action Month makes a lot of sense. So at Take Action, that's one of the things we do, is we really bring people together across the country to promote radon during November. And different organizations do different things. So this year at Take Action, for example, there is a November campaign where people can take images of themselves doing things like taking out a test kit from the library or talking to a friend about radon. They submit that image, and then they're eligible to win prizes. And some of them are quite significant, including tickets for 2 from WestJet, visits to ranches, and high-end kitchen appliances. So that's a new thing this year that's being offered. But every year there's a different theme to Radon Action Month. And this could be something libraries could promote, particularly if they're already promoting Lung Health Month in November. Each province has regional supports. So there are regional reps in each province that work for Health Canada that do radon awareness and promotion. You're going to hear from our BC rep, I think, in a few minutes. But just to know that beyond the Health Canada representatives, there are also the lung associations in most provinces are involved in radon and can facilitate the setup of library lending programs. Lung PEI is one, and then again in British Columbia, we have a significant involvement by our lung association in our radon testing program for libraries. The other resources naturally are Airthings, who are the creators of the manufacturers of the digital device, and then Health Canada nationally. And I think at this time, I'm going to turn it over to Lydia Chu from Health Canada, who's been working on an innovative program to address people who are on the wait list for detectors. So we know that in some provinces, people are waiting over a year to get a library lending device. So Lydia, I'm going to turn it over to you for this slide, and then I'll just, yeah, go ahead.
Great, thank you. Thanks, Anne-Marie. So hi, everybody. I am the radon specialist in BC from Health Canada. So I'm talking a bit about the Radon discount code pilot project. We started this pilot project last year, and we're going to continue running it again this year. Essentially, this program provides patrons of the library the use of a discount code to receive a discount on a long-term test kit. And the 3 suppliers that are running this promo code is AccuStar, Radon Corp, and Lung Sask. So library patrons can use this discount code to purchase a long-term radon test while they're on the wait list to borrow the test kit from the library, or after boring, they can use the discount code to follow up with a long-term radon test. So the Radon promo code is essentially one word, Radon promo, and the discount ranges from $5 to $10 off, depending on which supplier is chosen. And on the images you see on this slide is the promotional material that we will be sending out to the libraries in BC and in Alberta. And that includes the bookmarks, which is the long image on the right. And those can be either placed in a test kit or they can be placed in the reception of a library, whichever way is easiest to distribute to the library patrons. And then there's also posters that can be placed up on the walls in the library as well. Yeah, that's mostly it on my end, Anne-Marie. Back to you.
Okay, Lydia, thanks. We might have some questions in the chat after, so I'll let you address those if those come in. Okay,
Sounds good.
And just to say that, so the digital devices, you can purchase them, people purchase them online. And the same with the radon test kits, they can be purchased online as well. They're often not in hardware stores, although you may hear people say you can go to a hardware store to get them. But online seems to be the most reliable way of accessing a longer term test kit. Another thing to know in the library is that in each province, there are people who are certified to be radon professionals who can do radon mitigation or testing. So just a caveat for people to know, it's something that radon that could be promoted even within the catalog. So there's a national entity, the Canadian Radon Proficiency Program, that provides training and certification for radon professionals. As Caitlin mentioned, radon is an odorless, colorless, tasteless radioactive gas. And so making sure that levels are low in homes requires the use of a certified professional. And as a result, people might have questions about where do I find somebody to fix my home? So the easy answer to that is please visit this website where you can type in your postal code or the province that you're in, and it will give you an up-to-date list of the certified professionals in that region. And this is really important. If people do need to undertake radon mitigation, there are some new opportunities that I'll talk about in a minute, but they need to have hired a certified professional in order to be able to access some of these, for example, mitigation grant programs. So understanding that this exists, you might want to put this somewhere on a page where you're talking about radon so that people have easy access to radon mitigation professionals. There's another interesting campaign that exists that's hosted through Take Action on Radon. If you are a health librarian or if you have people come and talk to you about inquiries about radon, if someone has lung cancer or someone in their family has lung cancer, we have a program where we provide a free test kit. So again, we have cancer agencies lending our devices. So these are common questions there, but this is open to all public libraries across the country. It's actually to anybody. So you could promote this if you do have particularly a health librarian, you have someone come in and doing research around lung cancer. If someone has tested positive for lung cancer, then you could access this program. So just another good thing to know. And we do have people access this quite frequently. So as I mentioned, there is starting to be more grant programs for radon mitigation. Radon mitigation on average costs about $3,500, which might be out of reach for some people. So just so that the libraries know, there is both a national program, which is what this program is, offered by the Canadian Lung Association. Again, they have a separate program for people who have been diagnosed with lung cancer, and then one for people that is means-based. So it is not a guarantee if you apply that you will get the funding, but if you are a low to moderate income income household, you may be eligible if you've used a professional mitigator. So this program could also be a resource that could be hosted. And then each province, so well, except maybe for British Columbia, but many provinces are starting to have their own programs where they provide funding. And then in Ontario, there's a particular program for new homeowners. There's a warranty program where people can access funding to get radon mitigation through a home warranty program, which is important. So radon is approached differently in each province, and as a result, libraries in each province might want to have a different fleet of resources. So this is just a quick overview of the free resources that Health Canada currently has. They have infographics, and then brochures, and then there's also the bookmark that Lydia noted as well. Take Action, we also have resources, including we have our own bookmark. Down the bottom right, we have some pins that we can give out to people if they're interested. This could be something, a giveaway for Radon Action Month. We have postcards, infographics, posters, and there's actually a large banner too that can go in a library. And this is the JOT form. Pam can put that in the chat as well. And then I'm just going to make a pitch at this moment for some upcoming workshops. If you want to learn a bit more in BC, we're having our annual Radon workshop next week. It is free. It's virtual, so you can attend across the country. And our area of interest is radon in a changing climate. In Prince Edward Island, they're having a radon workshop that's in person. So if you live in that part of the world, it's at the Red Shores Racetrack, which sounds pretty fun. Much more fun than sitting at home on a virtual call looking at my BC lung workshop. So that sounds exciting. Public Health Ontario is hosting a Radon Rounds. That's next week. It is virtual, but it requires registration to attend. This is focused on public health professionals, clinical health researchers, and others, but it is also open. And then the National Collaborating Center for Environmental Health has a free public rounds from 12 to 1 Pacific time next week, and that is also virtual. So we can put links to those in the chat. It is Radon Action Month, so that's why we usually don't have so many radon workshops all at once. So I think what we'd like to do now, with the time that we have left, is turn it over to questions, discussions. We really want to hear from you if you have a program or if you have questions about setting up a program. So I'll leave this for a minute if people want to write down anything. But just to note that if you don't have a program yet, you would copy this link, or Pam can put it in the chat, and then you can go and fill out this form, the Radon Monitor Lending Program form. That provides you access to the guide that can walk you through how to set it up, and then the materials that you can tailor specifically for your library. Okay, I'm going to stop sharing now.
That's great. Thanks so much, Anne-Marie and Caitlin and Lydia. We do have a couple questions, so I'll jump right into those. And the first one actually is, I think Lydia, I'll get you to answer it. There is a question about the coupon program. Is that available for all libraries across the country?
Yeah, so I think for certain regions, they already have some discount code programs running. So we're really only sending the promotional materials to BC and Alberta. But the promo code can be used by anyone. So the word Radon promo, if they were sharing with friends, they can just put the same promo code when they're purchasing, and it would give the discount to that person. So it doesn't have to be limited to library patrons. It is available to be used.
Okay. So then are you okay if other libraries print the resources themselves and or have some way of directing people to that code?
Yeah, I think it's that there are certain regions that already have discount programs. And so we're not sending our promotional materials there. But if they do want the promotional materials, they can definitely reach out to me, and we can send the resources to them.
Okay. And so I think Leah from New Brunswick Lung chimed in that they have discount codes as well. So Leah, maybe I'll just get you to put your email in the chat. So if anybody in New Brunswick wants to reach out to you, then they can do that. Yeah.
Yeah,
and
I can
then
put my
Lydia,
email.
if Alberta or BC libraries haven't got the resources, then you can help them. That would be perfect.
Sounds good. Yeah, I'll put my email in the chat.
Great, good. Oh, there is one note that says the promo code says it's expired on the AccuStar website, so maybe we'll get you to do a little troubleshooting there.
Yeah, so I'm just in the process of getting those promo codes up. And some of them have them. Yeah,
Okay.
so I think within the next week, they should be active. So
Okay.
if there's any, issues with it, people can email me and I'll get that sorted out.
Okay.
Thank you.
Okay, sounds good. And another question about, so Anne-Marie and Caitlin, maybe I'll get one of you or you to chat about this. When you have, if a library has patrons who are eager to borrow it and insist that they should be able to use it during the summer months, do you have any suggestions on how libraries should manage that?
Do you want to go ahead, Caitlin?
There we go. Sorry, I'm used to Teams, so it takes me a moment to find the unmute button. Yeah, so we do have people who are obviously very keen to test their home as soon as possible. If somebody's really interested in wanting to start the test right away, that's totally fine. We just recommend that they test their home for a little bit longer than 3 months. So if they are going to start the test in July, let's say, we'll usually tell them to run it through until November or December. Or the other question that we ask is, how do they live in their home? Are they somebody who is a closed doors and window, runs the air conditioning all year round? And if they are somebody who does that, then their research is showing that it will likely be a more accurate reading. So they could comfortably do a 3-month test, but the official messaging from us is that we would recommend that you just extend the test longer into the heating season months.
Okay, so yeah, there's a question about just clarification on, so you're recommending that libraries loan the detectors for 3 months and they don't loan them out for May to August?
So best case scenario, we would love it for libraries to lend out the test kits for 3 months. However, we do recognize that the wait lists are very long, and typically lending time for libraries is that 2 to 4 week period. So it is important to communicate that these are meant to be a screening program. So regardless of whether or not you are lending, if you are a library who's able to lend it out for 3 months, that's wonderful. If you are not, we still recommend that patrons still purchase a long-term test kit and long-term test their homes. This is meant to be a screening program only.
Another question about bilingual resources. So I did put the link to order the bookmarks and posters from Take Action in the chat. Caitlin, the Health Canada resources are also available in both languages. Is there an easy way for people to order them?
Yeah, so all of our resources are fully bilingual. You can email the general Radon account, which I will post in the chat, requesting a list of what publications we have available for print. Also in the coming months, there will actually be an easier way to do that specifically online from our resources page. We're just going through the process of that right now, but I will pop our email address in there and you would just email us directly and let us know that you are setting up a library lending program or you already have a library lending program and you would like some resources, and we'd be happy to send that to you free of charge.
Wonderful, thank you. Good. All right. So some good chatter about sort of some practices that different libraries are doing. So one talked about the fact that they printed the coupons last year that they used. They printed them out and provided them to patrons, but then also had a poster so that people could access it there as well. So we will send a follow-up email after this webinar. With some of the links, but then we will also, once those promo codes are live, we'll send a follow-up so that you know that they're live. Okay, and then next question, or maybe a follow-up to the question that we just had, with 3 months being the recommendation, would a 6-week loan program period, would a 6-week loan period be better than a 3-week loan period, or does it make a difference?
Anne-Marie, do you want to answer this?
Well, is Julie on the line?
Yeah, I can see if she'll want to join the
Did
panel.
ask if
Just
she,
give me a
so
second
longer
here.
is better. As Caitlin noted in the beginning, because the radon levels can fluctuate, what we're trying to do is get an average. And the one nice thing that the digital device does is I think that it shows people in real time that fluctuation. And I think it kind of drives home this idea that, you know, that we need to be testing for longer because that level can go up and down, and you can even see it'll give you an average. So longer is better. Oh, and Julie is here. So would you like to talk about the device at all, Julie? I know you can be a bit shy. But yeah, the longer that people have the devices in their home, the more accurate their understanding of the radon is. But I'm going to pass it over to Julie to comment on that.
So as Anne-Marie was saying, the program is really advertised as minimum, you got to do at least 30 days. As so Caitlin was saying, it's a snapshot, and that's what it's meant for. But anybody who wants to start a program, I'm happy to answer any questions. And the device itself, it's a handheld device that's, as you can see here, and it's very easy to use. And anyway, the person or the library patron that's borrowing it is well taken care of, because the libraries have also been provided with the instruction manual, so they know how to use it. They know what to do next if, what to do after those 30 days are over. Go to Take Action on Radon. Here's a list of all the approved devices that you can purchase, how to find a mitigator and everything. And it's really straightforward. And a lot of libraries have done a fantastic job. And I'm not sure if NB Long is also on the call, but the last presentation was fantastic. What they're providing the library patrons, the documents is wonderful. I wish everybody could see it right now, but they're definitely a good example as well.
And I
Sounds
just want to
good.
jump.
And
Sorry, Pam, just quickly. I think ultimately, if libraries are following best practices as much as possible, so not lending during the summer months, and then making the decision to perhaps do a longer lending period, like 6 weeks. We are seeing anecdotally that many patrons are making decisions about mitigation based on the screening, whether or not that's them deciding to test further. So setting people up for the most amount of success to not have a false positive or a false negative by not lending the devices over the summer months and having longer lending periods means that there will be a better chance that they will have more accurate results if they do decide to take let's call it what it is, the easier route of making a decision based on their digital numbers from the library lending program, rather than going out and conducting an additional 3-month test. We like to talk about what we recommend and best practices, but that's not always followed by people, and they often are taking the easiest route, which we can all understand. Life is quite busy, so if we can set people up for the most amount of success, that is the idea here, right? And that's really where that coupon discount code for the wait list, to encourage people instead of waiting. Some of these library lending programs have 18-month long waiting lists. Instead of waiting 18 months for a digital detector, that they could go online and purchase, a long-term test kit for $50 to $60 and have the results back in 3 months, which is much shorter and much more accurate than waiting the 18 months for a screening result from a digital device.
good. And on that note, one of the questions was about a library that's just considering starting up a program. Do you have a recommendation of how many devices that they might want to start with?
If I can chime in, I'd say you need a minimum of 2. Because you need once they're no longer in circulation, with the documentation that Pam and her team provides, you need to compare them. You need to make sure that they're working properly. that they're both, if you have two, that they're giving you the same results or close enough. And that's the only way, is you need two. So again, two is bare minimum, depending on how big your community is.
We have seen library systems buy them and then move them around between the libraries within their system. And in some regions of BC, one branch will want more than others. So they've been able to fluidly move around the devices between different libraries within one system. So I think that's another strategy too. A system could buy them and then have them go to the places where the demand is the highest. I'd like to talk quickly about how people can fund these programs. We saw a number of different ways emerge from our work in BC, including people applying for grants and funding for indoor air quality or digital library resources. So some people have been very successful in obtaining funding to expand Library of Things programs. And radon devices fit very nicely into that concept. So if you are interested in augmenting your indoor air quality testing, for example, around fire smoke or carbon dioxide or other kind of gee-whiz monitors that people can access, like the radon fits very nicely into that collection of things. There is also funding that can be, you can talk to your lung associations about helping to fund. There are some nonprofits in BC that also provide detectors for certain libraries and have initiated programs. The cancer agencies have been purchasing them. And then we've also seen programs where actually realtors or other concerned citizens will purchase devices and donate them to libraries as to help set up library programs. So the funding options seem quite varied, and I keep being surprised and interested to learn that people have started them in different ways and different reasons, and then just capital budgets. So I think there's a lot of different, and if you're wanting to start a library program and you're looking for ideas for how to fund it, then please reach out as well.
Yeah, I'm going to throw out a couple questions to our libraries on the line. If you can chat in. One of them is funding. If you're able to access creative funding for your library, it'd be great to be able to share that information out. So maybe you can share that with us. And then we can certainly, if you need help with accessing funding, you can certainly reach out to our team, and we can try and help connect you with some of those or various ways. Nice. Our Friends of the Library group provided us with funding. That's awesome. That's great. Good. Okay, and then another.
Oh, go ahead, Pam.
Go ahead. No, you go ahead, and then I'll jump in with another.
The Peterborough Library folks are here, and I know that they had started quite a big program. So I just wanted to thank them for attending. And yeah, if they wanted to share anything else about their program, it says we started the radon monitoring program in Peterborough, and it's been an absolute success, and they have a long wait list. So yes, this does tend to happen, so this idea of having at least two is probably a good idea.
Nice, good. So another point, if libraries have already set up and they want to access more monitors, then they can certainly also reach out. So it's not just for new programs. You can also reach out to us if you're looking for ways to get new monitors.
Can I just speak to what New Brunswick Lung did? I think Julie referred to it in the beginning, but in New Brunswick, they've created a very lay guide for folks, recognizing that often people who are taking these devices out, they may be older, the digital divide may be an issue for them, or English might not be a first language for people. So they've created this really great, simple little booklet that they've put in their radon kits that they hand out. So if you're interested, Leah, I think, is the connecting person for that. And so, yeah, if you'd like to offer this in a way that sort of addresses those issues of readability or comprehension, then I thought they did such a good job of that.
Nice. And so, yeah, we will include Leah's email. She has put it in the chat, and we'll also send it out with our follow-up email, so you can reach out to NB Lung. Great work.
We also see people do different. So some in New Brunswick, they have a little tiny kit. Like if space is an issue in your library, in BC, they do use these plastic tubs. Some people use a crossbody bag that everything fits into that. So when people leave, they can carry it all home in an easy way. And then there's the tiny tubs. So if you have a different way that you provide people with the Radon kit, as we call it, then I'd like to hear about it, or you could send us photos. We'd be really interested to know, is it taking up all this shelf space, or do you have just a little tiny thing that you've created? Snap lock food containers from IKEA. That's right. That's what those were, Leah. Those were really awesome. And I'm amazed that
Yeah.
you fit everything in that little kit.
I think there's a similar style at the dollar store. So if you're in a community where there's no IKEA, but you have a dollar store, I know that they have had the similar zip kind of snap lock containers in the same size as those ones. So yeah, nice.
And the nice thing about the devices is that, I mean, they are electronic device and we're not asking, like, please don't throw them around, but they are pretty robust. So they can be moved around and things are not a very delicate electronic monitor that people have to carry home like eggshells.
Yeah, and if you do have questions, as you find people coming in, if they are asking you questions to you about radon that you aren't prepared to answer, you can certainly direct them to the provincial lung groups that are in most of the lung groups. There's some frequently asked questions on the Take Action on Radon page too, so you can certainly reach out to us as well if you're getting questions, and we can add some of those questions to some of the radon pages, so we can circulate those if they're provincially specific. Then we'll make sure that the provincial pages get those and add them to our Take Action page.
Yeah, Erin from Peterborough, sounds like they have a slightly different container. So yeah, I'd love to see a photo, Erin, if you want to send that to me, then we can put it up in our gallery of what radon lending looks like across the country.
That's great. Good. We also so just a couple clarification about the events. So we did put links in about some of the upcoming events that are available. So BC Lung has a workshop that's online, that's open to anybody across the country. Prince Edward Island has a workshop coming up that's an in-person workshop. I think it's also open to anybody across the country, but it takes a little more work to get there in person. And then, Anne-Marie, you were mentioning a couple other, the Ontario Rounds and the NCCEH workshop. Are those also open to the public that we can circulate the information to?
Yeah, I did put the links in there. The Public Health Ontario one is by registration only, and they will have numbers that fill up. It is one of the first rounds, I think, that's been done in Ontario for a while. It is aimed at a more medical community, but it does include, and it has some technical information, but if you're a librarian and you're interested in coming to learn more about radon, you're more than welcome to join. The National Collaborating Center for Environmental Health also has a webinar that same day, and it is about community testing. And that's one thing we didn't, I'll just quickly shout out here to libraries who are actually providing the alpha track detectors, so the long-term detectors through libraries. And that's another option, is that we have the 100 Test Kit Challenge distributes free test kits once a year to different communities who apply, and libraries are often involved as a place where those are handed out. So we'll be talking about that community program, the community engagement model at the Public Health Ontario rounds and the NCCEH rounds. And that is on the Thursday. I'm sorry, I got my dates mixed up. It's November 28th. I just would like November to be over because I'm a teacher as well. So the end of term is coming. But it is, yeah, we have a lot going on next week. And it's Wednesdays and Thursday that the presentations will be. Yeah, they are open to everyone. They're different flavors, though. So a bit more technical on Thursday, and more about the environment on Wednesday.
I also just wanted to tack on to what Anne-Marie was speaking about in regards to 100 Test Kit Challenges and working with municipalities. From a federal perspective, we've been working quite closely with a lot of municipalities across Canada, and we have found that many municipalities and municipal policymakers, as they learn about radon and discover that their community has high levels or may have high levels, are becoming much more interested in taking action on radon. So, reaching out to your local town councils, or your mayors or your policy workers at your municipal level might be another way to see if there's additional funding or if there's something that you guys can collaborate on. There are municipalities who are making decisions to purchase radon, long-term radon test kits in bulk and may not have put together that. Providing education and awareness through libraries is a good way to be able to spread that message. So we really do encourage that collaboration. At the very least, if you reach out to them and they don't know about radon, and then they find out that your community or your community library is starting a library lending program, it may be an opportunity for you to have more support in your community for testing.
Right. Yeah, so keep in touch with your policymakers. Great. Well, thank you all. We really appreciate your presentation and the information. So thank you, Anne-Marie and Caitlin and Lydia for sharing some of the work that's going on. And then also a shout out to our lung groups that are on the line that have been helping out with libraries in their provinces. So thanks, Leah and New Brunswick, doing a great job. I know Nova Scotia has also been supporting libraries in their province as well as PEI. And I think New Brunswick has been supporting Newfoundland as well. And then, of course, we thank Jamie in Alberta. And then the team, there's a whole bunch in BC that have been supporting the program there too. And Adam in Manitoba and Saskatchewan has been supporting libraries in Saskatchewan. And I think there's been a variety of support in Ontario. So great work to all those groups. We thank you and appreciate your time and continue to reach out. We will be hosting another webinar in the future. So let us know if there's questions that we haven't answered and how we can help support you. But we want to continue to communicate and make sure we get information out that's helpful for you. All right. Thank you all and have a great day and happy Radon Action Month.